So what Mandy and I are going to show you now is how to do a subtalar neutral assessment. I'm going to demonstrate it in prone and just go over a few talking points first. So the purpose of the subtalar neutral examination is to get a standard non-weight bearing assessment of the foot and ankle bony structure that a person is living with. There's three relationships that we want to look at. We're going to look at the relationship of the lower leg to the calcaneus to the metatarsal heads, and the relationship of the metatarsal heads amongst themselves as well. So the first thing I'm going to have Manny do is flip over onto his stomach. His foot's going to hang just off the edge of the table. If you can scoot down just a little bit more. Now, actually, sorry Manny, just a little bit more towards the head right there. So you could do it prone, completely prone, or we can have him rotate into a figure 4 position with his opposite leg in order to stabilize his pelvis and prevent any false testing, so to speak. So in order to get a good orientation, I like to mark the bisection of the tibia and the fibula, as well as the bisection of the calcaneus. And so I look at the tibia and fibula and I draw a line right in the middle. I as well kind of grab the edges of the calcaneus and then I mark that bisection as well. After bisecting, I'm going to use my right hand and I'm going to palpate for the head and neck of the talus on the medial and lateral sides. Once I have that palpated, I'm going to grab with my left hand to adduct and abduct the foot in and out until I feel the medial and lateral head of the talus to be pretty congruent on both sides. Once I have congruency, I'm going to gently put some pressure through the 4th and 5th metatarsals, and now I have my standard position that I want to assess. I have my bisection lines, and in a neutral foot, those lines are going to be parallel. In a varus foot, you'll see the line of the calcaneus going diagonally across the bisection of the tibia and the fibula. So I'll be able to assess rear foot position, either varus or valgus of the calcaneus. Then if I look at the plantar aspect of the calcaneus, I'm going to be assessing its relationship to the metatarsal heads to see if the forefoot is in a varus position or a valgus position. Lastly, I'll grab the metatarsal heads to assess if the metatarsal heads are in the same plane, or most commonly, the first ray will be either plantar flexed or dorsiflexed, which can demonstrate various compensations during gait.